Hello, doctor. What are the risks of polycystic ovarian syndrome? Because recently my doctor informed me that I have polycystic ovarian syndrome. Thanks, doctor.
Hello. Of course, there are a lot of risks related to polycystic ovarian syndrome. It is related to developed diabetes mellitus, cardiovascular illness, and also might be reason for many cancers like womb cancer, breast and ovarian cancer. A polycystic ovarian syndrome is also related to infertility because of less ovulation. Plus, PCOS is reason for pimples and more hair growth in face, especially upper lip and chin, which known as hirsutism in medical terms.
Hello, doctor. Today I was surprised because my doctor told me that mostly I have polycystic ovarian syndrome. I don't know why. Can you explain me why this happened? And what to do? Thanks, doctor.
Hello. Polycystic ovarian syndrome is not illness. Because we don't know what is the exact reason for it. It is a syndrome, means it is a collecting of many symptoms and complaints which patient is suffering from. So the diagnosis of polycystic ovarian syndrome is not easy, because we have to exclude many illness which is similar to it. Like thyroid, adrenal and pituitary gland illness. Some theories of polycystic ovarian syndrome. First, PCOS might be genetics, means there is family history of polycystic ovarian syndrome. Second theory is hormonal disturbance, insulin is increased in PCOS, which lead to increased androgen. Third theory, that is, polycystic ovarian syndrome is accompanied with obesity. 20% of polycystic ovarian syndrome are non-obese.
Hi, doctor. Can you please explain me how do you know that I have PCOS? Thanks.
Hello. Diagnosis of PCOS is difficult because we have excluded other similar illness like thyroid, adrenal, and pituitary illnesses as hyperprolactinemia, which it means high prolactin level. There is criteria for PCOS diagnosis, which known as Rotterdam criteria, 2 of 3 rule. Means existence of 2 or 3 coming factors. First factor is high androgen. Either through laboratory results, high testosterone either free or total 1. Or through clinical appearance, which means hirsutism or acne. Second factor is either ovulation disturbance, which it means less or no ovulation, in medical terms is known as anovulation. Or menstruation disturbance, which it means less or no menstruation, in medical terms is known as oligomenorrhea or amenorrhea. Third factor is ovarian features through scan, which can be seen in one or both ovaries. We can see PCOS ovary as many small cysts inside it, which it is known as follicles, its number up to 12 or more. And the diameter of these cysts between 2 to 9 millimeters. And, or, ovarian volume is enlarged, which is more than 10 milliliters.
Hello, doctor. These days I have a lot of pimples and more hair growth in my face. I don't know why. But by scan they told me that mostly I have polycystic ovarian syndrome. Can you explain me why this happened? And what to do? Thanks, doctor.
Hello. Yes, there is strong bond between polycystic ovarian syndrome and pimples. Also, PCOS is a reason for more hair growth in face and other parts of the body. This is because hormonal disturbance. In polycystic ovarian syndrome there is high insulin level, which it will increase the androgen level. Mostly it is testosterone type, which leads to acne and hirsutism.
Hello, doctor. These days I have chest pain and breath difficulty. I don't know why. But by scan they told me that I have polycystic ovarian syndrome. Can you explain me why this happened?
Hello. Yes, there is a relation between polycystic ovarian syndrome and cardiovascular illness. Lipids disturbance is seen in around 70% of women who have polycystic ovarian syndrome. This also related to high androgen level, which is induced by high insulin level. Androgen will increase the level of bad cholesterol, which is known as low-density lipids, its medical name is LDL, and triglycerides will increase also, and its medical name is TG. It is bad cholesterol because it will collect in blood vessels walls which lead to cardiovascular illness like blood clots and hypertension later on. While good cholesterol, which called high-density lipid, is low. Its medical name is HDL. Important point here. How to screen cardiovascular illness in PCOS? The answer is through measuring BMI, fasting lipid profile as above mentioned, and to determine risk factors of metabolic syndrome.
Hello, doctor. Today I have checked my blood sugar. I was surprised because it was high. I don't know why. But last month my doctor told me that I have polycystic ovarian syndrome. Can you explain me why this happened? And what to do? Thanks, doctor.
Hello. Yes, there is strong bond between polycystic ovarian syndrome and diabetes mellitus. Diabetes mellitus will increase 5 times more if a woman has polycystic ovarian syndrome. The mechanism is insulin is increased in polycystic ovarian syndrome because of insulin receptor dysfunction, which means insulin resistance. Here insulin is increased in the blood, but it is not working because its receptor is not working. This will lead to high blood sugar in spite high insulin level in the blood. This will explain how insulin and blood sugar are both high in polycystic ovarian syndrome, which lead in the end to diabetes mellitus. Note by, all we know that insulin is a hormone, it is secreted by pancreas. Insulin is responsible to collect blood sugar from blood and push it inside the cells, which in the end will result in lower blood sugar. Means control blood sugar in the body. So the normal relation between them is, if high insulin, means low blood sugar. But in PCOS, both insulin and blood sugar are high because of abnormality in insulin receptor which is found in the wall of the cell. The question now is, how to screen diabetes in PCOS? This will be through OGTT, which it means oral glucose tolerance test. It means taking 75-gram glucose then to check. First, fasting blood sugar, which is supposed to be more than 100. And then to check 2 hours postprandial, which is supposed to be more than 140. So checking only fasting blood sugar is not enough to screen diabetes. This test is used to screen diabetes and metabolic syndrome too.
Hello, doctor. Is there any relation between polycystic ovarian syndrome and cancer? Can you explain me, please? Thanks, doctor.
Hello. Yes, there is a bond between polycystic ovarian syndrome and cancer. Cancers related to PCOS are womb or uterus cancer, breast cancer, and ovarian cancer. All we know that progesterone is working against estrogen effect in the body. Estrogen is hypertrophic factor, means it induces excessive growth of the cells in the body. While progesterone is hypertrophic factor, means it is decreasing the growth of the cells in the body. Always there is balance between of estrogen and progesterone. This balance will protect woman body from a cancer. Mechanism of uterus and breast cancer are same in PCOS. As we said, androgen increased as a result of insulin increasement in PCOS. Androgen will converts to estrone. Estrone is responsible for excessive growth of the cells in the lining of the womb and the breast, which is known as hyperplasia of the cells. This will lead to uterus cancer and breast cancer. Estrogen in PCOS is unopposed by progesterone because no luteal corpus body, which is responsible to produce progesterone as there is no ovulation, as above mentioned. However, the mechanism of ovarian cancer in PCOS is different. Mechanism here is the ovulation induction medications, which we are using these medications to manage infertility in PCOS women. For that there is always limited times to induce ovulation through woman lifelong. This strategy is made to decrease incidence of ovarian cancer.
Hello, doctor. I have been married long time ago, but I don't have children yet. I don't know why. But recently my doctor informed me that I have polycystic ovarian syndrome. Can you explain me why this happened? And what to do? Thanks, doctor.
Hello. Yes, there is strong relation between polycystic ovarian syndrome and infertility. Infertility has happened in PCOS because of less ovulation. Also in PCOS, period is irregular and intervals between periods are longer than usual. And irregular vaginal bleeding could be seen, sometimes there is no periods for months and years. Above has happened because of high androgen, which induced by high insulin level in the blood. Androgen will transform to estrogen, which is the weak type estrogen called estrone E1. E1 has not enough TO induce ovulation. This means that the follicles in the ovaries will stay small and collected in the ovarian walls, so this will explain the name of polycystic ovaries. From another hand, we know that pituitary gland, which is the leader gland in the body. It controlled the other gland in the body like ovaries. As estrogen increases, as we mentioned, this will affect pituitary gland, which respond to release luteal hormone, which called LHAS positive bond between it and estrone, but without LH surge, this means no ovulation and will increase the thickness of the ovarian wall. From another side, there is a decrease in follicular stimulation hormone, which called FSHAS negative bond between it and estrone, which lead to no dominant follicle but only small multiple cysts under the ovaries wall. Also, in polycystic ovarian syndrome, LH will increase twice compared to FSH. And the final result of above is an infertility. As there is no ovulation in PCOS, means there is no luteal corpus body, which exists after ovulation in the ovarian tissue. Luteal corpus body is responsible to produce progesterone from the ovary. This means estrogen in PCOS is not opposed by progesterone as in a healthy woman. This will lead to malignancy later on either in uterus or breast. While known results of low progesterone in PCOS patients are or menstruation disturbance, means irregular vaginal bleeding, less or no menstruation, which is called in medical terms as oligomenorrhea and amenorrhea.